Leg skin diseases. Number 1. Dermatitis, eczema, including stasis or varicose eczema. Shows red, scaly, sometimes oozing patches, often associated with venous issues or dry skin. Number 2. Scaly rashes. Psoriasis, lichen planus, basal cell carcinoma. These can appear as thick, scaly plaques, psoriasis, purplish flat bumps, lichen planus, or early superficial skin cancers. Number 3. Venous stasis dermatitis, stasis dermatitis. Illustrated with leg discoloration, swelling, and patterns typical of chronic venous insufficiency. Number 4. Various rashes and infections, for example, cellulitis, tinea. Images of inflammatory or infectious skin lesions, like bacterial cellulitis or fungal rashes, cheekily remind us of the broad range of conditions affecting the lower legs.
Why it matters. Visual comparison helps identify potential issues. However, many conditions look similar, even to professionals, so a dermatologist's diagnosis is essential. If you notice persistent redness, pain, or changes in your skin on your legs, it's best to consult a